Hey there, I hope you are doing well. Dr. Joanne Michelle Martin here. I am a pelvic floor physical therapist and the owner of JMM Health Solutions located in Duluth, Georgia in the Atlanta metro area. So welcome. So I get this question a lot. What is pelvic floor therapy? Simply put, I like to tell my clients pelvic floor therapy is the specialty of everything between the belly button and the knees. That's right, everything in the middle. And a lot of people are finding that many of the things that the issues they had, the complaints they had, may be lumped up into pelvic floor conditions. So, in the middle of our bodies, we've got our pelvis, right? Our pelvis, it's attached to the spine, our hips attached there to really the center. And we know that the center of anything needs to be strong. It's comprised of muscles, primarily the pelvic floor muscles, which help to stabilize the pelvis. They help to support the pelvic organs. They help in sexual satisfaction. They help in keeping pee and poop off the floor because they keep you dry. So they serve a lot of purposes. But the pelvis is also the attachment point of a lot of other major muscles, your glutes, your hips, your hamstrings, your quads, hip flexors, you name it, right? So we've got a lot going on. We've also got nerves, we've got plenty of blood vessels in the area. So there is no shortage of action in the pelvis. Now, pelvic floor therapy is a specialty within physical therapy that encompasses the care, the treatment, the rehabilitation for any issues that may be going on in that area. What might that be? We specialize in working with individuals that have bladder issues, bladder dysfunction. We specialize in working with individuals that have bowel dysfunction. We specialize in working with individuals who are having pelvic pain. We specialize in working with individuals who are having issues with regards to sex, sexual appreciation, sexual dysfunction, and so on. So, a couple of things that might be happening. You might be having incontinence where you can't control your urine. Or your feces for that matter, but you might have urinary incontinence where you jump, you cough, you sneeze, you laugh, and you leak. You might be having urinary urgency where the urge comes on and you have got to go as soon as you feel this urge. You may be having pain every time your bladder fills. People with the condition known as interstitial cystitis feel this way, painful bladder syndrome, where they are having pain every time they feel like they've got to urinate or every time they urinate. You may be having issues where you're having hesitancy and you're not able to urinate when you go to sit on the commode. You might be having bowel issues. Constipation is a huge one, and that can happen at any age as well. You may be having constipation issues. You may be having issues just getting poop out. You may be having issues trying to keep the poop controlled, whereby you're leaking. And so, this is another issue that we deal with quite often. In kids, one of the biggest things that I see is a diagnosis called encopresis, where little kids, usually around age 4 and up, have soiling in their underpants typically because of constipation issues, but sometimes because of lack of control. You may be having pelvic pain where you've got pain anywhere around the pelvis. Now, this could be from the muscles being very, very tight. It could be from neurological issues. It could be from trauma. Maybe you fell and you broke your tailbone. Maybe you've had a hip or a groin injury, hamstring injury, something of the sort, but we have got some pain somewhere around the pelvis, whether it's in the back, at the SI joint, near the sacrum, the tailbone, whether it's in the front by the pubic bone. This may be occurring during pregnancy or even after pregnancy. You may be having issues with sex. I work with several clients who have yet to consummate their marriages because of issues like vaginismus or pelvic pain, dyspareunia, which is just another fancy word for pain with sex. But they may be having issues with sexual appreciation. So we either have no sensation when we're attempting to have sex, we have pain when we're attempting intercourse, whether it's externally, whether it's internally. We have just not pleasure. It's not pleasure. We're not having orgasms, right? And now here's the thing, guys. Pelvic floor health just doesn't affect females. Pelvic floor health can affect anybody. If you've got a pelvis, there is a likelihood that if there's an issue going on in that region, you may need to see a pelvic floor therapist. I work with kids as little as potty training age, all the way up to the very elderly. As long as you've got a pelvis, you can see a pelvic floor therapist. And lots of us specialize in different things. Now, I was mentioning, talking about, men can have issues too. Erectile dysfunction is something that we see quite often. Chronic pelvic pain syndrome, where they're coming in with pain, oftentimes mistaken for a urinary tract infection or some type of bacterial infection, but most often is a pelvic floor issue. So we see these things all the time as pelvic floor therapists. If you are dealing with any of these things, whether you're young, you're a teenager with pelvic pain, you're having pain inserting a tampon, you are, an older female and you're having issues in the menopausal period, a lot of these things are related. And oftentimes people may not think so because it takes on average about 7 to 8 doctor's visits for many people with pelvic floor issues to get them diagnosed. These include things like endometriosis, painful periods, genitourinary syndrome of menopause, you name it. There are so many things that may be going on that oftentimes individuals are told, you just need to relax. It's all in your head. Have you heard this before? Because if you have, I assure you, it is not all in your head. So if you are experiencing any of these issues, please, please, please reach out to a pelvic floor physical therapist. You can find them in your area. A simple Google search might suffice. There are directories out there. And just know, because an individual is not on a directory, may or may not mean anything specific about that individual. Sometimes people are on directories just based on different organizations they may be affiliated with. You can check the American Physical Therapy Association, they have a directory. Pelvicguru.com also has a directory. Like I said, you can always just Google your area, search your area, pelvic floor physical therapist near me, and see who comes up. Again, I'm located in the Atlanta metro area in Duluth, and I see clients from all over the Atlanta metro area and rather really throughout the state of Georgia. I also see clients virtually. So if you have a question pertaining to pelvic floor health, pertaining to pelvic pain, pertaining to any type of urinary, bladder, bowel, sexual dysfunction, please definitely let me know. Drop it in the comments, or you can find me on the website, www.jmmhealthsolutions.com. I would love to help you. And just know there are solutions for pelvic floor dysfunction. So if that's you, if you're having issues, don't wait. Don't hesitate. Reach out to someone who can help you now. Bye, guys.